Hello, welcome to Leadership and Culture in Healthcare. I'm Matthew Winn, a podcast host, and I am delighted to be with Tracy Allen. Tracy, welcome.
Hi.
Introduce yourself, tell everybody what you do, where you do it, how long you've been doing it.
Sure. I'm Tracy Allen, as Matthew said. I'm the Chief Exec of Derbyshire Community Health Services Foundation Trust. And I've been the Chief Exec since 2011, when I was appointed as the inaugural Chief Exec on the establishment of the organisation. I'd actually been in Derbyshire working within community services for 3 years before that. But been a chief exec since 2011. And then prior to that, Matthew, this is my 33rd year in the NHS, and I joined as a NHS grad trainee back in 1990 with a geography degree that equipped me for very little, but a passion for public service born out probably of my parents, who had a similar passion. And apart from a brief, ultimately unfulfilling sojourn back into academia early on in my career, I've worked in the NHS ever since.
So I won't be naughty as I normally would do and say 30 odd years. Surely not, but that's a long history, isn't it?
Yeah.
And it's a long history with your organisation since 2011.
Yeah.
And do you think that's important about why your staff in Derbyshire community say the organisation's doing quite a good job?
I do, and I think I've grown to believe the importance of that more over the last few years, where I think there's been evidence, research published, Michael West and others, who I think in the last few years have challenged what was certainly the NHS management ethos when I first came into the NHS, which was, you climbed a career ladder, you moved on every 2-3 years. And I think people have done some pretty good work to correlate, it's not causation, is it, kind of stability in terms of leadership with positive staff engagement outcomes, and the corollary of that, which we both know is really closely linked, which is positive quality outcomes for citizens and patients.
Hmm. And the staff in your organisation have got you as a trust top or jointly top in staff engagement, morale. What's the other ones we've got? One voice that counts.
Yeah.
We are safe and healthy. So some really great areas. What have you done that sets you apart from other organisations to have the staff saying you're doing well in this area?
So I've reflected on that when you asked me to do this, and I think it's really difficult, because I think a lot of it I've probably taken for granted. In 2011, in fact, before 2011, when we were being established as an organisation, I, with the executive team, put a lot of effort into developing something that we called at the time the DCHS way. Now, there's loads of ways now. There's the Leeds way. And I'm not entirely sure if I'm right, but we were certainly a very, very early adopter of what we called the DCHS way at the time. And we worked with about 500 colleagues right through the organisation to come up with a really simple, there's nothing clever about it, Matthew, a really simple framework that said, why are we here? How are we, what are the values that we're all going to share? What do we expect of each other? And how are we going to work? So there's a vision and values, there's a contract about what's expected of me as a member of DCHS, what the organisation's commitment to me and all my colleagues is, and then some really simple stuff about how we organise ourselves and around being quality people, providing quality services, and being a quality business. And we have stuck to that framework. We've tweaked it and we've brought new things in, but we've stuck to that framework for the last 12 years. And interesting, right from the start, part of our vision was that not only were we going to be a great provider of services and support people's overall health and well-being, but we were going to be a great place to work. Now, again, in this current context, when you think about the NHS People Promise, the importance of belonging, that seems like, yeah, so what? But actually at the time, I think that was quite unusual, that 2 bits of our statement, of our vision: provide great services, be a great place to work. And that because I believed, you believe, we now know those 2 things are inextricably linked. And then we were, again, right when we, from establishment, we had a people committee, a quality people committee at the same level, 3 board subcommittees, one around kind of finance and performance, one around quality, one around people. Again, I think that's very common now, but I don't think it was very common 12 years ago. So I think it started with that, and then we've been really, really rigorous about making sure that everything fits into that. So if you're going to have a way of working and a set of values, you need to make sure that your appraisal systems kind of mirror that. You need to make sure that the way that you recruit and develop leaders mirrors that. You need to make sure that the way in which the board behave with each other and with colleagues right through the organisation mirrors that. So I think it's a set of soft things about, you know, how I speak to you and how we work together, and hard system and process things. And we've, I think, when I'm asked to consciously reflect, what we've done really well is to challenge ourselves every time we're thinking about something new as to whether it fits that DCHS way, and make sure that we fit what we're doing into it. And then there's a whole set of other things. You know, we've got a staff forum, which is a group made up of a whole set of different people from across the organisation. So union representatives, staff governors, network chairs, and they hold the executive to account. You know, we meet every 2 months. They set the agenda, they hold us to account. So again, if you're going to say that everybody has got a voice that counts, you've got to have structures in place that support them to see how they can. We've just revised our strategy, and it's been a really fascinating process, quite challenging for me because I wasn't in charge of it. I think we've moved further than we ever have before in terms of kind of co-production, not just with citizens, but with colleagues in the organisation. And I found that really, really challenging. We've come up with they've come up with a fantastic strategy. And again, it's really interesting to see how much that reflects the DCHS way that we started with, but also how it's helped us kind of tweak it in terms of the changing contexts we're working in.
That is fascinating, Tracy, because everything you described in hanging off the DCHS way is about creating culture, isn't it? It's about, it creates the ingredients that then becomes the culture of the organisation. And you've talked about how therefore everything needs to align, and that sounds quite important in that respect. Do you want to just talk a little bit more about the practicalities of making all of that align and become symmetrical, I guess, in terms of what staff can expect from the organisation?
I think, well, sometimes it's about not taking, it's about, it impacts on the decisions that the board takes. So I can think about things like, you know, it would be much cheaper for us and much more effective to move bank staff off a weekly payment scheme. Actually, we've got some of our lowest paid staff can opt into a weekly pay. And about every 2 or 3 years, somebody comes up with a plan during our kind of CIP process that says, you know what, we could save a bit of money on this. And I think it's then having the discussion about, and not just at board level, but with the staff forum, with people across the organisation about, is that working in line with the DCHS way? And so I can think of several examples like that where we've not made decisions, or it's influenced the way we've made decisions. I think it's about, you know, the effort and the emphasis that we put into quality people. So that's I'm really proud not just of our kind of staff wellbeing offer, which is very comprehensive, extremely well used, but I'm also really proud of the professional training and development work that we do. And one of the things that colleagues tell me a lot that is important to them about feeling good about working with DCHS is the opportunities that they get to develop professionally, and particularly around kind of multi-professional training and development. So I think it's about, if you're going to say these things, you've got to be able to put your money where your mouth is, and be able to demonstrate that you're doing them.
And make, as you've just described, make choices at times when those things jar potentially against how you want to run the organisation. And then one of the things that I guess falls out of that, Tracy, is you set that up in 2011 through some great engagement. How do you keep that current, though? Because you said you haven't tinkered with the framework much. Everything else is aligned around it almost. But how do you and the board and the team then say, let's make sure this is right? It was great for our staff then. Is it great for the staff now?
Well, we've done it through our organisational strategy review and redevelopment process. So that's every kind of 3 years. As I say, this last year we've just gone through it. So we use that as the formal opportunity to review, because the DCHS way has to be embedded. It's a really, really important part of how we implement our strategy. So there's a rolling programme of doing that. And as I say, really, really comprehensive process of involving as many of my colleagues as possible. We're really fortunate. We have a psychological insights team within the trust. We jointly provide that with Derbyshire County Council, and it's part of our health psychology team. And they have been really, really fantastic. And I've learned a lot with that about how to do really good co-production, as I say, both with citizens and community. But a benefit of having them that I didn't think I was going to get was the way in which we engage with colleagues right through the organisation.
And would you say that the co-production with citizens, people that use your service, is a development than from where you started in 2011?
Yeah. And I still think we've got a much further to go with that co-production. I think we are further ahead as an organisation in terms of working with everybody who works in the organisation. We're making really good progress on that work with, we should be, shouldn't we, as a community trust, part of embedded in our communities. We've still got a way to go, but this round of the strategy was a big step up for us in terms of demonstrating the voice of citizens and communities in Derbyshire into our priorities.
And last thing in this kind of section of our discussion, I always think there's potentially a fault line at times between a staff group that it feels in charge, is hugely supported as you are describing, but when you start to overlay that with citizen views on what they want, those things aren't necessarily always in alignment. Sometimes they are, sometimes they're not. So how have you as a team trod through that to say, actually, we're doing great, but our citizens are saying we need to do this? That could put on staff feeling supported and comfortable in what they're doing potentially.
Yeah. I think, I don't pretend to have all the answers to that, and I'm kind of smiling. So I think that is definitely a really live issue for us. And there's another one that I'll come back to around. If I was to be really blunt around it, around that challenging an incredibly well-intentioned, compassionate, paternalistic clinical response sometimes, and it is really, really challenging. And I think, again, this psychological insights team, our health psychologists, they are increasingly working, not just providing health psychology as a clinical service. This might be one of the things that differentiate us. I don't know how common it is, but embedded in some of our other clinical teams. So we've got clinical health psychologists embedded in some of our children's teams, in some of our intermediate care, reablement, urgent care teams. they're not providing a direct clinical service to patients there. They are working with teams on the sort of quality conversation, health coaching. What matters to you is what matters to us. We've had a massive program around what we call quality conversations, health coaching, right through the organisation. We now provide that training right across the whole health and care system. So I think it's about gently but consistently working on those things in a supportive way. I don't know if I've answered the question. The other one I was going to say, you might be going to ask me about this, but the thing we're finding quite challenging now is DCHS has got a really strong positive culture. Colleagues in DCHS love working here, by and large. Still loads we can do. And now, of course, what we're asking of them is to work in much more integrated ways with people from other organisations. And that how you build out from organisations with very strong cultures from that base to then create new collaborative cultures across multi-organisational, multi-professional teams is really hard. And I'd love to talk to people. Maybe your next series can be about people who've gone and done that, because I'm finding that really challenging at the minute.
I think you're right. I think that's a series in its own right about leadership and culture in healthcare that is beyond our own boundaries, where different cultures will butt against each other, not for any bad reason, but they just will. And how do you then navigate that through? I think that's a fascinating area that, frankly, is the meat and veg of integration, isn't it? We talk about integration, but if we don't get that bit right, people will not align what they do. So a great view on your culture and the organization, how you've got there. Can we focus on you though? And no chief exec that I know likes talking about this, otherwise they're slightly odd. But what's been your personal impact amongst all that? How would you codify Tracy Allen's impact on the organization to deliver what you have just described?
I think I've been consistent. I am authentic. I think people in the organisation will say I have made it really important. I've made a focus on people getting to know me and who I am, and that's really hard with 5,000 people across a huge county and city. But I do a lot to make sure that people know who I am and what I'm about. I put a lot of time and effort into being out and talking to people, being approachable. I do all the things that you and other great chief execs will do. I own up to the mistakes that I make. I try and symbolically, I guess I'm really consciously overemphasizing, hopefully not to the point where it's obvious and inauthentic, but I am emphasizing all the time the values that we have all agreed that bind us together. I've been here a long time and I'm really proud of that. I do a personal email to colleagues every week, or nearly every week. I wouldn't want to be charitable. I don't think it's every week 100%, but it's the most read communication in the organisation. And every now and then somebody says to me, what kind of a team do you have behind that? I'm like, I don't have a team. That is me. I've got a distinctive voice and everybody knows my voice. And I like to think it's the same whether you meet me in the corridor, whether I'm coming out to spend a morning with you in your clinic, or whether I'm writing to you, or you see me in the boardroom. I think it's that kind of consistency. And then I've worked really hard to recruit people. I've had fantastic exec colleagues and chair and non-execs, but I'm more in control of the execs right from the start. When I recruited the first exec team, my job descriptions were very clear that the first section on them was about what I was looking for in an executive member of the team, a set of behaviours, a set of values, and then what I was looking for in a medical director or a finance director. And I've recruited to that. And we've had lots of change. I've just had 2 colleagues change in the last year and got really, really different people. And yet it's felt seamless, and it's been great because we share values, but with very different perspectives. But fundamentally, I've recruited people who want to work as part of a team-based organisation with a set of shared values.
Yeah. And an interesting, again, kind of fault line potentially there in the visible, approachable, authentic people knowing you, huge county, 5,000 staff. Why have you alighted on that being important? Why do they need to know Tracy Allen properly as opposed to Tracy Allen, the chief exec?
That's a big question. Okay, it's two things that immediately occur to me. So one, I think, is the bit about belonging and about a culture where people feel safe, not just feel safe, are encouraged to bring the whole of themselves to work. And I can't say that that's really important. I mean, I happen to believe that it's really important from a recruitment, retention, quality point of view if I don't do it. So I think that's really important. I think the other bit that's always struck me, my career before I came here was in acute hospitals. When you work in Chesterfield Royal Hospital or Norfolk and Norwich Hospital, you've got a very physically defined identity as well as being a surgeon or a nurse or a porter. When you work in a community trust, you're in teams. There's a much less direct physical geographical identity between colleagues. The team who work out in Chapel-on-le-Frith Health Centre and have been working there for the last 10 years are very, very geographically disconnected, job disconnected from the reablement ward down in Swadlincote. And I think it's really important from a quality point of view that we develop that really strong identity and sense of belonging and shared values and shared commitment. I think it's really hard to do in a community trust, but I think it's an even more vital part of a quality improvement, quality assurance framework in a distributed organisation like ours than it is in an acute trust. Does that make sense?
Yeah, no, it does. And my hunch would, because obviously this is my background, is that you have to work that much harder on it than you perhaps do if you can walk around your single site, and
exactly.
you never take it for granted as a consequence, I think.
Yeah.
And those are fascinating, but what's informed how you have led since you've been the chief executive, Tracy? How have you come to this way of operating? Because I think earlier on you said it was slightly unusual. Not many people were doing lots of things that you started. So who's influenced you to operate in this way?
Lots and lots of people. All the way through my career, I've been lucky enough to work with some really fantastic leaders who have shown me so clearly that this is a people business. The work that we do, even in the most high-tech areas, it's all about relationships and it's about interpersonal connections. And so I've seen great leadership and I've seen really, really poor leadership as well. And I remember when I was first in the that awful HSJ top leaders thing, and the first time I made it into that, and somebody said, well, the brilliant thing about Tracy Allen is she's never been like a performance monkey. She's never just been driven by targets. And I think I've seen really poor leadership that is focused on numbers and targets and hit this and do that. And I've seen really great leadership, which is about hearts and minds and our shared purpose. So I've seen it in action, and then I've been really lucky to have some great development opportunities. And I think one of the biggest was, and this doesn't happen now, but a whole team of us, when I first came to Derbyshire, was shipped off to Harvard for their sort of top leaders program. I was there for a couple of very, very intensive weeks, and a real theme there, and some fantastic global case studies about the long-term success of organisations who focus as much, if not more, on their staff engagement and culture as they do on their citizens and customers. And again, you look, now that is the received wisdom in the NHS. CQC have got evidence to show that really strong correlation. You look at Timpsons of this world, they're the people that inspire me, and you see it in action, don't you, when you're out with your colleagues and you see what they're doing with patients and how they're supporting each other. And it's just always made sense to me. But I've had that academic reassurance of something that I think I just instinctively believed and have seen working.
And Tracy, for the last bit of this blog, your passion, your desire, your to be a great leader, to for this territory just oozes through. Always has done. Every time I've seen you and talked to you over the years, what? How do you sustain that? You've been, as you say, been there since 2011. What keeps Tracy Allen jumping out of bed, and well, maybe you don't jump out of bed. Maybe that's the reason. And getting out of bed, coming to work, putting all this great energy into Derbyshire community. What's at the base of all that?
Well, great question. I mean, it's really hard. So, and people ask me about what it feels like to do my job, and I'm unashamed now about the fact that it does take a lot out of me to do this job. I want to do the job well, and to do it well takes a lot out of you, because and it is an emotional commitment as well as an intellectual one. And I think I've got better over the years of recognizing that, and being able to set boundaries. I can't keep going at that energy level for 70 hours a week after week after week. In some way, I mean, I've had some quite serious health problems in the last few years, and they've been really good. I mean, not good overall, but good at helping me understand, managing my energy and some boundaries. So, when I'm at work, I'm really at work, and I put a lot of effort into being present, and I work really hard, but I don't work massively long hours. I put the boundaries in. I've got great support around mentors, around informal networks. I've used coaches, all the things that everybody does. And I think then the other thing I do is I make sure that I put enough time in my diary doing the things that refill my cup. And that is going out with frontline clinicians or clinical support or admin support with frontline colleagues, seeing what they do, being inspired, being humbled by what they do every day, seeing the impact that they make on patients and citizens. And that then gives me the energy to go back into the 6 hours of ICB stroke NHSE stuff, and to keep going, and fundamentally, Matthew, I believe in the NHS, and I will work as hard as I can for as long as I can in whatever roles I'm doing to sustain and continue to improve the NHS. So it's a whole range of things, but I think the thing that I would is it is really hard work. I find it really hard work emotionally. So you have to work consciously on managing that energy and making sure that you can come into work each day ready to be what other people need you to be.
And clearly, for anybody who follows Tracy on Twitter, you will know that she spends lots of the time out in the open air, always posting pictures of moors and beautiful, beautiful landscape in the Derbyshire world that everybody else then looks at, especially where I live
Without a brace of gorgeous
flatlands.
Labradors, Matthew.
Well,
Without a brace of gorgeous
there's always
Labradors.
a downside in everything. Final question for me, Tracy. What would you say to someone who wants to be an NHS leader, who comes to you and they might be listening to this and say, oh, yeah, that sounds great. That's what I want to do. What's your sanguine advice for someone embarking on their leadership journey in the NHS, as you did many, many years ago in the grad scheme?
Go for it. It's a fantastic privilege. It's incredibly hard work. It's a contact sport. It's all about people and the relationships that you will build. And so, you need to prioritize being out there. It's not a role that you can do sat behind a control center looking at spreadsheets and emails. And build your support network early. The thing that I constantly emphasize to people I'm mentoring, and I found in my own case, is that the NHS is stuffed full of people who want to help other leaders develop. And I've never found anybody who hasn't been generous with their time, their advice, their counsel, and their energy when I've asked them. So, build a network, ask for help, ask for opportunities to stretch yourself and develop. And I think they will almost always be forthcoming.
Tracy, it has been wonderful listening to you talk about the DCHS way. Wonderful unpacking some of the things that I think you rightly said, we take them for granted, but actually they are the core things that actually support our staff to be fabulous. And clearly the organisation's doing well because your staff are saying you're doing well in the results that they have published, and no doubt will publish next year when the next staff survey results come out. Thank you so much for spending time talking all things leadership, culture in healthcare. It's been great.
My pleasure.